Hello, Ds, and welcome back to the latest Spanish news update and Benidorm news update. We are in a gorgeous park with some lovely weather to let you know everything that has been going on, and it's going on right now in Spain, Costa Blanca, and in particular in Benidorm. We have three news as usual to talk to you all about. First of all, is the tourism update. What's going on now? What are the future events? What you might expect, etc. The first confirmed calendar for lights festival and Christmas lights being turned on in different cities, when it's going to be happening. A very big change on the Ibiza Street. What's going to be happening? Will the businesses be affected? Will the apartments, apart hotels, accommodation options be affected by it at all? Because it will take a long time to complete. The last news will be for all those who want to live here in Spain in the future, or maybe are living here already but do not know as much information just yet. Do you actually need a private health insurance while living in Spain, or you can calmly live with the social security public insurance? First of all, let's talk about tourism update. What's going on right now? It is still quite busy in different cities: Benidorm, Altea, Albir, Villajoyosa, Alicante, surrounding areas. It is still quite busy. There's quite a lot of people. The occupancy was on average 87-88% during the November fiestas and the fancy dress party, which was epic, by the way, and solidarity party, which is not less important fact to state. There were a lot of people. Now a lot of them went away, but others arrived. So we still have a very, very high occupancy in a lot of hotels. And by now, previous years, many hotels in Rincon de Loix or other parts of Benidorm in particular were closing down for winter. This year, barely any hotel is doing it. Even hotels such as Hotel Nadal, for example, or a few others, they are open still because there's a lot of affluence of people. There is still quite a high occupancy, and it makes sense to stay open and not shut their doors. There's going to be a lot of interesting events going on. We've talked about it in the previous news update. The 23rd of November, the Benidorm Half famous event already for all the runners. I personally would wish to participate maybe next year, maybe in 2 years, but eventually I would love to participate in this event. This event will be held through different Benidorm streets. There's going to be half marathon and there's going to be 10K. And more than 6,200 people already have purchased their dorsals, like their numbers. This is a sports event. It's a healthy event. And it's fun to see so many people running around Benidorm town. It makes city even more alive than it usually is on some specific days. After that, we will have the turning on of all the Christmas lights, all the Christmas decorations, the fair, everything. Benidorm last year did it slightly later on. This year, what we do know so far is Alicante Christmas dates. Alicante has published this already, and as you can see here, it basically says that from 29th of November up until 19th of January, there's going to be the Christmas fair. Not only the Christmas fair, but in general, all the Christmas decorations, all the lights, everything will be turned on. All the lights will be blinking, and there's going to be a lot of magic in the air. 29th of November, it is when officially all the lights will be turned on, all the Christmas lights. We do go every now and then. Last year we didn't go because we went to Benidorm's one because it was on the same day. But if it's going to be on different days, we will definitely go and film it for you guys because it is incredible. They use more than 1 billion of decorations in quantity. More than 1 billion. That is bizarre. More than 120 streets will be sparkling with Christmas lights. So if you are a fan of this type of holiday, of this time of the year, of this season of magic, Alicante is your place to go. Benidorm still did not publish the program. They do it almost like last minute every single year, which I personally would improve. If they would let me, I would do it earlier for you guys so that you could plan in advance, but usually it's like a few days before. Technically, it's on the first days of December, like from 1st towards the 5th, 6th maximum. That is when the Christmas lights are turned on in Benidorm town. By the town hall, there's like a speech, there's concert, they're turning on the lights, there's fireworks, there's countdown. So it's a very nice thing to do. It's a special holiday atmosphere that many people are seeking. And apart from that, we will have a never-ending fair. We'll have Christmas markets. We will have different types of expositions, the open-air museums. We'll have concerts. We will have fireworks, the New Year, the Three Kings Day, the Boxing Day. There's so many things that are waiting for us in the months of December and January. And now let's head to the main news. First, one of them being the giant change and building work that will be happening on the Ibiza Street. This is one of the famous streets, Girona Street, aka the British Street, Lepanto, and Ibiza Street. They all go parallel and they all are crossed by Mallorca Street, which is the strip, which is where all the nightclubs and pubs are located in Benidorm town. And this area is very popular amongst international tourists. This is the area where many of your popular bars or restaurants are located, where many accommodation options are located too, and including hotels, hostels, apartments, apart hotels, or private residences used for holidays. And this street has been experiencing quite a lot of issues with drainage, with like sewage systems, with in general the supply of water towards the buildings, because it's very, very old. It has not been renewed in decades, and it desperately needs this renovation. So the town hall has taken the idea to do it right now when the tourism is slightly lower in this part of the city, which I think is all right. It's better than in summer, right? So they're doing it now. What happens is that these works obviously will have some noise. Obviously, they're gonna be blocking different parts of the street. It's gonna be almost all the entire street, so it's quite a long way to go. And these building works will start from 25th of November, so basically less than a week's time. It's gonna be here. And up until Easter holidays, that is months and months of building work. So this leads me to a question. Will businesses be affected? Will accommodation options be affected? What's going to be happening? Since it's something that requires destroying completely like the cement, the road itself, they need to destroy to open it all up, to dig inside to actually take out all the plumbing, all the sewage systems, the drainage systems, the new pipes for the water as well. So there's going to be a lot of holes, there's going to be a lot of noise, whatever they will be basically lifting up the entire road. And there will be some noise. They don't say up until which point businesses will be affected, but obviously, there might be some places where it's going to be slightly uncomfortable to access. There might be some noise during daytime, especially. When all these works will be done, we will have a brand new road, brand new street. The pedestrian sidewalk also will change, and they will adapt it to the design of the area. Maybe they will do it something similar like on Mediterranean Avenue. Maybe they will put the tilings as in some specific parts next to the cultural center of Benidorm. They'll just renew it. It's going to be nicer. It's going to be more modern probably, and it's going to be safer. All of these works are great unless they will be affecting the businesses and accommodation options, which hopefully it's not going to be the case so much. Let's continue with the last news that I wanted to share with you all, and it's about the necessity or not to have a private health insurance in Spain. All those of you who are maybe living here, or those of you who planned on living here and you were checking out the information, maybe you are even checking our official website for the migration consulting company that we have, that was founded a couple of years ago by us in person. It's not some people who are working for us, it's us as it is. We specialize to provide all the information for those who want to live in Spain. We specialize in providing them searching for the property, for purchase, for long-term rentals. We provide health insurances that are needed for the documents and residence permits here, amongst a lot of other things, opening a bank accounts, padron at the town hall, etc., etc. So we know quite a lot about it. And as a former hospital worker in the emergency department, I've also treated quite a lot with private health insurances. While we have to be grateful that Spain has a public health care, which isn't the case in many countries of the world. For example, in US, unless you have an insurance or you pay, bad. Okay, here it's not the case. We pay our taxes, we have our social security, we have our public health insurance, but there's a lot of issues with it. And by the official statistics that you can see right here on the screen, the cost per person per resident in Spain is 20% less as the average in the whole entire Europe. For example, the dental care, you know that here in Spain, and if not, you're about to know, in Spain, social security and public health insurance do not cover dental things. Either you have an emergency or you need something like specific, it's not going to be covered by public health insurance unless it's specific reasons, unless it's specific things, and these people have specific age, like small children or very, very older people, then it might be covered. But it's about 2% of all the things that are done by dentists. Only 2% are covered and the cheapest options. In comparison with the 35% of the European Union. So in European Union, on average, 35% of dental care is covered. Here in Spain, it's just 2%. There are other things that are not as well structured here, but it's been happening for decades and decades. It's not something new whatsoever. These are long waiting lists. We faced it out ourselves as well because we use both social security and a private health insurance. And huge waiting lists for operations, months and years sometimes. There's waiting time because before you need to go to your family doctor, like GP, general practitioner, then this person, this doctor will transfer you to a different doctor of a specialty where you need to go. Then you need to wait up until you see that doctor so that he would send you, I don't know, maybe it's a CT scan or a ultrasound or blood work, whatever you need in this moment. And then you need to wait up until that's going to be sent to you. The appointment will be sent to you and will be set it in. So that's a really, really long time of wait. And a lot of the times it's impossible to wait so long, which is why people here do have private insurances. That is our case as well. Personally, we have a private insurance because it is way easier, it is faster, it is more efficient, unless it's something minor that you can go just to your consultation office here, to your GP. All people here use private insurance because it's just better and faster. You can get directly to the specialist without the necessity of heading to the family doctor. You can ask him directly what you need, and if he thinks it's convenient, he's going to ask for it. The waiting times are much lower, and it just works better in all senses. That is why people do have it. Also, the worst part comes when you're waiting for results of scan, of blood work, of whatever it is. You're waiting for results, and in a private in a private sector, you would receive these results in question of a couple of days maximum. Some analytics, some blood work, they require more time of wait, but it's not going to be 5 months or 4 months as it is in the social security a lot of the times for slightly more difficult testing, for example, genetics testing. In a private, you will receive it in a couple of days. In a public one, you will wait 4 to 5 months to receive the result, which means that obviously everyone are choosing for themselves, but the vast majority of people are investing extra additional money into a private healthcare because it provides everything that people need in the time specifically when they need it and not months or even years after. Also, public health insurance does not cover at all glasses, contact lenses, or hearing devices. You always need to do it privately. It only covers it in some specific circumstances, but overall, it's like dental. You need to pay for it or have a dental insurance or any kind of insurance that would cover these types of costs. Not all is bad. In Spain, there is quite a lot of investment. We are higher than the average of European Union in terms of how much money Spain does invest in the public healthcare, which is a good thing. And also the amount of money, the spending of Spain, of the government, like of the economy, towards the medications and everything that's being given to you by the public health insurance, because a lot of medications are covered totally, or at least the bigger part of the price is covered. Private health insurance does not cover any kind of medication. That's the only negative point, probably, of having a private insurance. You have to pay the cost of the medication that they want to prescribe you. But even though these points are quite positive, even though for some illnesses, obviously public health insurance has better machines or has more investment to it, still we have lower amount of doctors and nurses per every 1,000 people here in Spain, which is 6.2 nurses and doctors per every 1,000 people. We are lacking a lot of staff. Specific regions in Spain, we're lacking it. So hopefully the situation can be getting better, can get better. But while it is happening, while we need to wait so long for different terms, for different prescriptions, for different analytics, for appointments of different kind, people will still prefer private insurance. And a lot of us do. Let us know if it's the same in your country, if people use private insurances having a public health care as Spain does, or if on contrary your public health care is working perfectly fine and you do not need to spend extra money on any kind of insurance at all. And now let's talk about the weather. What is going on here in November towards the end of the month? Will it be raining? Will it be sunny? How the last weeks of November will be looking like? Today it is sunny, but there's quite a bit of clouds in the sky, as you can see. Like this is going to be the whole entire week sunny slash cloudy, and then the sunshine will be back again. On Monday, the 25th, it will be raining in the vast majority of parts of Spain, but hopefully here it's not going to be the case. As for today, as for the temperatures, it's going to be between 20 and 22 degrees. Look at all this beauty right here. And the remaining days, approximately plus 20 as well. Like this, we are around 1 month, slightly more before Christmas. Gorgeous weather, just a tiny bit of clouds every now and then. No rain so far. We continue enjoying our region.